the things that tend to go viral or that tend to get viewed on these platforms like TikTok or Instagram or whatnot usually aren't good for your oral health. Like we talked about the whole mewing trend, and then we have these people with fake braces now. Did you know that was a thing?
DIY braces where you move teeth out of your mouth. Yes, the things that tend to go viral are more extreme and provocative and oftentimes negative. But you look at like trends that happened in, generally speaking, and challenges like kids literally eating detergent pods, right? Like that can't be good for your health.
What we need to figure out, or somebody in our audience, go get a true viral dental trend that's good for people, and like go get that started.
All right, I'm gonna start it right now.
This is the Open Wide Podcast with your hosts, Scott Drucker and Janesh Patel.
All right, and welcome back, everyone, to another episode of the Open Wide Podcast. Janesh, how's your Wednesday going?
It's going well.
Good. What's the latest from Boston?
I'm in our office today, so I get to be downtown riding the trains with everybody else. What about you? How's everything in Chicago?
Things are good. Yeah, we've had many days in the 80s here in September in Chicago, which is, I guess that's global warming for you. That I don't think would have been a thing 2 decades ago plus. So, so can't complain about the weather. Do you have your team go in with frequency to the office? What do you do? What's the uptime kind of routine?
Yeah, I think we try and encourage people who are next to each other, like our Houston office, our Boston office. I know we only have one person in Chicago right now, but
the Chicago office.
Yeah. And we do have an office over there. We just need to populate a little bit more, but once a week is what we ask. If you can go more, that's awesome. And then we have that place down in Florida where we actually have people going every day because it's like that repair depot. So it's like they actually have to do things in the office.
Yeah, that's manual work. There's no whatever zooming in from home.
Think about that. You just kind of like use like Oculus and like control like a robot to do all the things from home.
Although I will say I have one of those Nespresso coffee machines, and I went to do the descaling recently, and after I did that, I was having mechanical technical issues. So I go into the store and they're like, no, you have to call the helpline. I was like, all right, this is annoying, but went home, called the helpline, and I don't know why everyone doesn't do this, but they basically said, oh, we're going to email you a link real quick to a webpage or whatever. I guess it opened a browser, and where it prompted me to basically share my camera. And the person walked me through fixing the issue on the Nespresso machine while I was literally holding my phone, following what they were telling me over the phone. So we were on a call at the same time. So maybe you can phone in the repair. I don't know.
There you go. Yeah, that's true.
At the same time, I was surprised by it. And then the immediate thought after that was, why doesn't everybody do this? Why is this not the standard?
Look, I agree with you. We actually have a tool in our company that allows people to walk other people through a repair. And a lot of times it's used like technician to technician, like somebody who might be a more senior person that like has been there, done that, but they might not be in the same region, or they might not just be in the field anymore, but they know how to do this. And there's like a green brand new technician in somebody's office, and they could be like, go click here. Try moving this thing, like dial that back. And like there's some very interesting technology I think is going to take over very soon.
Yeah, I just thought it was really, really good customer service. And it's like, if you imagine, what if my best friend or my cousin was the expert in it? That's exactly what you would do, is you would just FaceTime them and they would walk you through the fix, right? Yeah. So anyway, we digress. You have some interesting articles you found. We can kind of share and then give perspective with the audience here.
Yeah, I mean, my articles might have been more clickbaity, I think, after we read through them a little bit, but I think the premise is sound still for what we wanted to talk about. So one of them was an article that came out in the UK, actually, but I think it plays here in the US. And the headline, although once you read into it, there's a little bit more detail into like the connection between dental health and actually mental health. But the headline basically says more Americans, especially the younger generations, know more about their mental health and how to take care of their mental health than their oral health and their dental health. And I thought that was interesting because, I mean, you and I both probably see it because more people talk about it more than ever. Like, do you have a therapist? Do you do this? Like, how are you feeling? How are you emotionally feeling? We think about mental health so much. It's so ingrained in our culture nowadays. And I'm happy for it. I'm not complaining about it. But it didn't dawn on me that we don't talk the same about the other aspects of health. Maybe when it comes to eating right and dietary stuff, we talk about a little bit more, but not where's your oral health and how does that impact the rest of your body and making sure you're always up to date on that. And I feel it's an interesting topic. Like, what do you think, Scott?
Yeah, I think so. Let's start up top. Let's start with the headline. It says 2/3 of young people know more about mental health than dental health. And then when you read the details of the article, it surveyed whether or not people realize that there are links from oral health to other types of health. And then 13% of participants felt they were better informed about their dental health than mental health. So that's only 13%. Majority of respondents, 85%, did not think, didn't think mental and dental were related. They're conflating a number of things here, but it
Yeah.
seems like the majority of people that they interviewed thought that they know more about mental health than they do dental health. So,
Right.
in my opinion, the headline should actually read 2/3 of young people think they know more about mental health and dental health. But I don't know that they actually gave them quizzes on mental and dental health,
Yeah.
right?
Yeah. Even,
So this is people's self-perception is, Gen Z in the UK thinks they know more about mental health than dental health. Just to be super clear here. And then, yeah, they cite a number of different types of health that oral health is related to. Don't actually go into detail on any of the science. And then say, quote, they cite percentages of the population or of the Gen Z population that realized that there was some connection.
yeah.
So,
Well, I think the interesting one there, Scott, was like only 53% knew that there was a link between dental health and oral cancer. Like, seems like a pretty easy jump to make, but only 53% said that they kind of thought that there was a connection there. And
yeah.
so I think it's more on the topic of there is so much around mental health nowadays, which
Mm-hmm.
again should be
It's a
because
great
it's an
thing,
important
right?
part. Uh, but I feel like people know like every terminology in the dictionary around mental health and the different kinds of conditions there are and the different things you do to solve for that anxiety or for that kind of situation. Or there's so much that we all know. So I probably would say that these kids are right. They probably know more about mental health and what it means and what it means to them versus like oral health. Like, hey, are your gums bleeding? Or hey, that tooth is aching. Like, you should probably go see your or your dentist because there's probably an issue there. And like these other aspects that they just don't have as much information about. Why is that? Like, that's what I really was like kind of. I had that epiphany moment when I was reading that headline. I was like, it's very interesting to think about it that way. I never thought about it that way.
Yeah, I think over the past 10 years or so, mental health has sort of boosted to the forefront of public awareness, and I'm sure COVID had a lot to do with that boost. But yeah, you're right. I don't think oral health is talked about or focused on in nearly the same way. This kind of bridges us to our the next article you brought up, and that is, where the in my mind, the next obvious question is, well, where are people getting their information from, right? Like, where do they become aware of things, right?
Mm-hmm.
And for Gen Z, the short answer there, what's different, what sets Gen Z apart from other generations is TikTok, in a word or in two words.
Yeah. Yeah, it's where a lot of us get knowledge nowadays. Even I use TikTok, like in the sense of I have some doom scroll like style things that I like to see or view or hear about. And like, I don't think I use it as aggressively as like the Gen Z or the younger generations do, but it's where they get all of their education. It feels like outside of school, it's like, that's it. And I think when we see all these quick snippet videos and all the targeted ads we get, like we get that information. We go into these like little circular logic, or we get in our own sphere of education because that's all we see and hear over and over again. And then we get conditioned on some certain kind of education. And it's usually not about oral health. I'll put it
Right.
that
So let's take that a step further and say, okay, so if oral health is not being either talked about or advertised about on TikTok, or the typical user of that demographic is not exposed to it, where did older generations get that exposure from, right? Like if their general awareness is maybe not as good as millennials or Gen Xers or boomers, why is that the case? Where was the education coming from? I guess is the simple question. And talking about this before, it seems like uh, classic commercials, like TV advertisements, is where a lot of people would learn. And I guess at this point now, it's not exactly a fair comparison, because your millennials and Gen Xers and boomers are going to have had statistically a lot more dental work. So they're going to be way more exposed from an experience perspective, right?
yeah.
But the goal is to prevent people from needing that work in the first place.
Yeah, I agree with you, Scott. We were thinking about that, and we're basically like, we all got educated, whether it was in the school, but like watching TV, like cable TV, there's these generic commercials that go out to the masses. And it's 9 out of 10 dentists recommend toothpaste A,
Yeah,
floss every day.
or
It's like,
four out of five recommend this sugar free chewing gum or whatever.
right.
Yeah,
And there's like PSA style announcements that are more like for the public consumption. And now we get in these little echo chambers and we talk about how smart these targeted ads are. Like, I think about needing a sweater and I get 5 targeted ads about sweaters. And like, I think about, wanting to get healthier and run, and I get all these nutritional facts and everything else. It's like, did you know you could do this to lose weight? Whatever it is, it's very targeted. Never does my algorithm say, Janesh might have a cavity. Let's serve him up some good dental videos and targeted ads for how he's
little
doing.
yeah, little did we know we are all Neuralink patients, and all of the social apps know exactly what we're thinking.
Yeah, so I don't think where they consume all of their, and even Netflix and like all the places we do consume TV and movies now, there's not commercials, or most of us pay for no commercials. So it's like
Right.
the only place we actually get targeted with ads are these places that are meant to sell us things versus like educate us on other items. And I think that's where there's been a big disconnect, and probably why we see less, or the generation below us know less about potential oral health and things that are very obvious to us.
So I'll say one rational conclusion that we can come to, that there is a lot of room for dental companies or the dental industry in general to be spending on these social platforms.
Yeah, I agree. I think it's like, yeah, make it engaging almost. Like, make it like a viral kind of videos, or make it some things that these people absorb, or better yet, Scott, co-brand it with something that is viral. Like these, whatever if it's a sneaker that's up for sale, who knows? Like, maybe you could put something else that's kind of closer to just overall health or hygiene or something like that. Maybe you do some co-marketing with other viral products that are already in the ecosphere.
Yeah, let's actually recap this article real quick. We've been sort of describing around it, but the looks like the California Dental Association Journal published an article. Let me pull up the actual article itself. The article is
Is it the
sorry,
assessing
yeah,
hashtag?
yeah. Their website is horrible and jumped me around like 5 times. Took me a while to literally scroll to the title. Assessing hashtag dentist content on TikTok, engagement, quality, and implications for oral healthcare. This came out, was it June of 2024? And just to jump to conclusions here, TikTok videos with the hashtag dentist are posted and engaged with. The majority, I think it was 75%, are actually posted by dental professionals. And in general, the quality of healthcare information varies, but is overall low to moderate quality. So not highly scientific in terms of rating here, but it's poor. It's not great,
Yeah,
quality content. And there is, I quote, there is the potential for dental professionals to post and promote high quality, evidence based oral health information on TikTok, which can impact the oral health knowledge and perceptions of the public.
yeah.
So, yeah, probably agree.
Well, I
The
think,
what's out there now is probably not great, and there's probably a lot of room to post, both organic and I'm sure paid advertising.
yeah, and I think, Scott, when we were talking about, we've been bringing these things up here and there throughout all of our podcasts, which is like, the things that tend to go viral or that tend to get viewed on these platforms like TikTok or Instagram or whatnot usually aren't good for your oral health. Like we talked about the whole mewing trend, and then we have these people with fake braces now. Did you know that was a thing? And that's obviously not a great thing. People
Yeah,
pay for fake braces. Like what?
DIY braces where you move teeth out of your out of your mouth. These are although I will say, so yes, the things that tend to go viral are more extreme and provocative and oftentimes negative. But you look at like trends that happened in healthcare generally speaking too, and challenges like kids literally eating detergent pods, right? Like that can't be good for your health.
Mm-mm.
It's the excuse my language, but it's the dumb shit that goes viral, right?
Yeah. Like,
That's what people want to see.
and then these kids are going to claim, well, I didn't know detergent wasn't good for me. And it's like, of course you didn't, because there's no ad popping up saying don't eat detergent. It's not great for you until it kind of finally got to enough attention because kids are going to the hospital where it had to come out in the news saying stop doing these things. Like,
Well, yeah, that coupled with parents and our school systems have failed us, but
yeah.
that too.
So I think what we need to figure out, or somebody in our audience, we should challenge them to like go get a true viral dental trend that's good for people, and like go get that started, and like let's try and educate these younger people with different kinds of content because what we're doing right now isn't working, or they're not going to the right places to learn. And most things, if they're all healthcare related, they're about mental health, which is great, but not about oral health or eye health or body health.
All
Like,
right, I'm gonna start it right now. I'm making up a trend that we should set in motion. We're recording this in the middle of September 24.
mhm.
Um, I think there should be flossing, not the dance, but the dental flossing ASMR. People should record themselves super up close with like the best flossing technique.
Interesting. Okay, look,
Weird enough, but squarely fits within that category of ASMR, listening to people making mouth noises or tapping their nails or whatever,
yeah.
and it could possibly be educational at the same time.
You know what? I'm not going to hate on it because crazier things have gone viral. I don't know if it will take off, but I'm down to try something. Or just like brushing your teeth ASMR because there's that like that scrubbing
Also,
sound.
yeah. I also think that to me, I don't know if you've ever seen videos of hygienists cleaning off like super caked on calculus. It's just like
Mhm.
absolutely disgusting, but it gives the same sort of satisfying or gratifying feeling as like the Dr. Pimple Popper videos.
I was literally going to say that. Yeah,
Yeah.
that's literally the
So,
same thing.
so yeah, maybe there's some space for people to brush and or floss super up close with their high def cameras and or microphones.
All right. Who do we know that's a popular influencer that we can say start this trend with us so we can see how if it takes off in any measure?
Yeah, I have no idea. I don't know about that world, but
Go back to Dr. Glenvo and Paul Goodman and see if they'll engage in their audiences for this crazy stuff.
yeah, exactly. So anyway, I don't know if there was more to unpack with that article, but
No, I just thought it was an interesting observation, right? Like at the end of the day, I never just considered it where kids don't know as much, and then where would they have actually learned about this beyond going to the dentist? And everyone's too distracted with their phones, anyways. Like they don't listen to what people are telling them. There's too much ADHD to go around as well. It's like you're talking to me, but like I'm thinking about 20 other things at the same time, and so it's like, where else can they get this education? I just never considered it, and I thought it was very, very interesting and something that needs a solve like sooner than later, or else a whole generation's going to suffer.
yeah, I don't know. It's interesting. Let's start the weird trend. At least that corner of people, that niche in the market will have good oral health.
For healthy teeth population or gum population, and it's like, how did that happen? Oh, there's a weird trend that went around for God knows how long.
Yeah. Exactly. All right. There was one more article on our docket today. It was along the lines of legislation that continues to pass to improve access to care and oral health. Do you want to
Yep.
take that one from the top?
Yeah, so I mean, obviously, a lot of the articles you've been reading are about access and improving access, and like I think that also goes on to education at some level. But it looks like Congresswoman Debbie Dingle, I hope I'm saying that right, from Michigan. They introduced a bill to expand dental coverage under Medicare and Medicaid with the Affordable Care Act and at the VA as well. And it looks like they say like too many people don't go to the dentist of fear or because they don't like the dental care, the dentist itself, like whatever it might be, they just don't go for dental care. And it's not just the fact that they don't go there, but some of them don't have access, especially when they have serious conditions. And there's just not enough adequate coverage. So they believe expanding this kind of legislation and coverage is just going to help with, one, reducing overall healthcare issues in their communities. I like it. It looks like every state now, and the reason I like to bring these up is like states, doesn't matter if you're red or blue, like it seems to be a very common thread that people need more access, and all their legislators are finally stepping up to do something to put it into a law.
Yep. And as we discussed on the last episode, providing that access is actually cost effective and cost saving long term because it will prevent emergency room visits and
look at
more burden on the system.
And look at these bullet points. So some of these actually tie into what we talked about education. So the first bullet point says this law extends comprehensive dental health insurance to millions that don't have coverage today. It ensures that there are more places people can go to get access to qualified healthcare professionals. So this kind of goes to, working with clinics and schools
I wonder how it does that. How does it enforce that there are more places to go?
That's a good question, and maybe we need to look deeper into that, but it looks like that's an aim of the legislation. The other one is it uses multiple strategies to increase the number of oral health professionals in the community. Again, we'd like to know the how, and that might be some of these like reducing the barriers to getting credentialed to different states. I don't know quite yet.
Important point here is that this article is about the introduction of the bill to expand dental coverage under Medicare, Medicaid, and Affordable Care Act. Yeah, so I think these are kind of goals and legislation. Here, there is a summary of it. Let me take us there.
Yeah, and then the last two bullet points where you do that is it authorizes funding for research on prevention of disease management to improve oral health. And lastly, educate current and future oral health care professionals and providers to better serve the vulnerable populations. So I think overall, it seems like they're trying to do what they can to increase the supply of providers, but also just the access for the patients.
Yeah, so I guess Michigan will be moving in that direction, and the bill's introduced and hopefully will be passed through to increase that access. But devil's in the details, as they say. So,
yeah, I'm just glad more people, these bills seem to be popping up everywhere. And I think it's like one of those like happens in enough places, then it might just become a new standard of how care should be provided.
Yeah, totally. Talk about research shows treating periodontal disease in people with chronic health conditions can save money. Up to $27.8 billion could be saved annually for Medicare patients with heart disease if the patients got the dental treatment they need. So to my point earlier about realizing that it's actually cost saving measure. Yeah, it's a win-win.
Going back to the article that had all the weird percentage and statistics, it said a lot of those kids didn't realize there was a connection between oral health and your heart health. And that's like that whole plaque conversation, right?
Yeah, like, totally.
And so I think overall just seems like it's going to help out a lot of people.
Yeah, I hope so. That and 85.7% of statistics are totally made up. The motion is all in the right direction. I will say that. Yay for increasing awareness and access to health, to oral health. Any other thoughts or exciting plans coming up?
No, I mean, well, for us, I know you know this, but we have a little baby on the way, so I'm going to be thinking about all the infant oral health care things I need. I've been reading up on like these pacifiers that are like dentist or orthodontist approved, and like if you have any of those articles, send them my way.
Yeah, I'll send you some. You want to be careful about the thumb sucking and the pacifiers, and the shape of the maxilla can actually be changed by it. And
yes,
so
that's what I've read, and now I'm scared, and so now I need to make sure
no, you'll be fine.
Pacifier.
You'll be good.
But that's the other thing that's on my mind. What about you guys?
Yeah, no, things are good. I don't have particularly exciting news. I'm going to some sort of like dentist cocktail hour tonight. An endodontist is hosting a whole bunch of people, presumably referral sources. So it'll be interesting to see. I looked, and a pet peeve of mine is that all of these events, all of these like social or yeah, we'll call them social or cocktail events in the dental world, all have continuing education appended to them. And it's the most frustrating thing to me because literally nobody is there for that class, and it takes away the time from mixing and mingling and catching up with people. So I think people should host specifically branded no CE dental event or dental mixer or cocktail hour or dinner. I think that would be refreshing to me, at least.
But then they don't get to write it off. That's their question, I think. Is they're like, we can use this as our education budget or our part of our business budget.
Because you have to collect the CE anyway, but then it takes an hour of people's attention or whatever, 40 minutes away from, whatever. So I don't know. It's almost like they're they have it. Nobody listens. I feel like people should just not pretend to listen and just enjoy.
I agree with that. Yeah. I say get the actual education you're trying to go for. Otherwise, like, only do it in a setting that you will listen and understand what's going on.
Exactly. Have you guys hosted I know you target the DSO market a lot, but have you hosted events for practitioners specifically?
Actually, we have not yet, but we are planning to. And it's because we now have a company called Front Office Rocks, which has more of the clinic staff. And we are starting to get more education for the actual dentist provider versus like the hygienist and everybody else. So like we are trying to build more of that core offering. And we do have some CE credits coming out because of that. So I think stay tuned.
It makes sense in a lot of cases. You are the company trying to educate the practitioner, so there is that give and take. But yeah, for a dentist who's hosting presumably a bunch of referral sources and whatnot, it's like, I don't know, I just want to hang out. I just want to chat with people.
Yeah, you should do it at a golf cart.
I don't want to be shushed to then not listen to whatever particular lecture there is. Maybe I'm a terrible student, so nobody follow my guidance here, but I'll speak for myself.
Maybe we'll do something like that. Well, just come to meet us. We're fun people, so just hang out with us.
Host a happy hour. Come hang out. That's more my cup of tea. But I'm very unconventional in many things. So
I've done that for manufacturers. Like even at Chicago Midwinter this year, like we hosted an event, and I think you were actually there. But it was like
Chicago Athletic Club, right?
And it was meant for just like hang out, meet other people who are like you, and just there's no real education. It was just like come meet some cool people that you might not have met before. And it's just manufacturers meeting manufacturers, vendors meeting vendors. Like the common thread was they all knew us, and it was like a really cool. We had a lot of good feedback from it where they're like, "This is great." Like it was just kind of a hangout, and I was not expected to do anything else. And I learned a lot about a lot of people because you're actually more curious the less you feel forced.
It's true. It may be counterintuitive, but that's very true. That venue is also a great spot in general, but for hosting events, it has like all of those games, right? There's like foosball and what's the huge board you stand on and push it, like shuffleboard?
The shuffleboard,
there's
right?
Foosball,
there's like some pop shot.
And so you're actually just like hanging out, having a good time, and probably more, whether you think it or not, more open to learning and making connections and whatnot. So anyway, enough rambling. Nobody wants to hear that. Or maybe they do. I don't know. That's why they tune in.
We're testing it all out.
Yeah.
No, awesome. Well, Scott, this was a good episode altogether.
All right, Janesh, always a pleasure, and hope that you all enjoyed, and we will see you soon. Take care, everyone.
All right, later.